Let's get to some of our important viewer questions this morning. This is an interesting one around immunity. Will we have lower immunity to colds and flu because none of us are in contact with one another right now?
It's a good question. I mean, these viruses that cause, colds and obviously influenza virus, these change all the time. And having limited contact with each other now is not going to really change our susceptibility to these moving forward. We're still going to be able to pick those up just like we would before. And of course, when the time comes, it's a while away from now, but when the time comes in the fall and the influenza vaccine becomes available, go and get it, because that's our best protection that we have against that virus.
Okay. There are still a lot of comments about passing people on the sidewalk. And this comes up because we often think to do the social distancing when they're face to face, but we forget about the side to side social distancing as well. So is it necessary to cross or walk on the street, the middle of the street, to avoid being near someone? And if not, how risky is it to walk past somebody like we used to? What's the likelihood of catching COVID-19 that way?
So, I mean, people are going to be, if you can, of course, we should stay 2 meters away. And of course, we know that that's not always possible. Sometimes there's narrow sidewalks or narrow paths and people have to cross and they're within that 2 meter distance. And that's, obviously we try to avoid that, but of course we can't avoid that 100% of the time. The risk of transmission for that second where people are passing within a 2 meter radius of each other is almost 0%. Like, it's extraordinarily small. Of course, in medicine, just like in life, nothing is 100 or 0%. But the risk for that split second where people are walking past each other, even if one person is infected, if you don't touch them, you're extraordinarily unlikely to get infected through that.
All right, some people have reported losing taste buds or sense of smell for a few weeks, but they feel fine. Could that be a minor case of COVID-19? And does that count as having had it?
Yeah, no, so it doesn't count as having had it yet, but we're hearing more and more people who have disturbances in taste and smell. And there's even some data that's emerging that says, maybe about 25 to 30% of people might have that, along with some other symptoms. We don't have all the answers yet, and certainly there's ongoing studies that are looking to see how that interacts with COVID-19. We should also remember that, it's actually a very common symptom to have with other upper respiratory viral infections. So it's not specific to COVID-19, but it certainly may be a component of this infection as well.
Here's one around workspaces. A lot of people are working from home. How often should we be deep cleaning our living spaces, wiping down counters, etc.?
There's not going to be a one-size-fits-all answer to that. I mean, most people who are really physically distancing and, only going out to get, groceries, essential items, and maybe going for the occasional walk or jog outside to get some exercise, I wouldn't really change any regular habits that you have. But of course, there's going to be some individuals who are essential workers who might be out and about, who might be in contact with lots of people depending on their job. And, in those cases, especially if there's other people living under the roof, you might want to increase the frequency of cleaning the major contact surfaces in the house, just to make sure, in case someone brought something home or brought this infection home, that these surfaces are cleaned a little more regularly.
Dr. Bogoch, thanks so much.
Anytime.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.